Methotrexate (MTX), formerly known as amethopterin, is a chemotherapy agent and immune system suppressant. Methotrexate was made in 1947 and initially came into medical use to treat cancer, as it was less toxic than the then current treatments. In 1956 it provided the first cures of a metastatic cancer. Methotrexate clinical uses. It is used to treat cancer, autoimmune diseases, ectopic, pregnancy, and for medical abortions. Types of cancers it is used for include breast cancer, leukemia, lung cancer, lymphoma, gestational, trophoblastic disease, and osteosarcoma. Types of autoimmune diseases it is used for include psoriasis, rheumatoid, arthritis, and Crohn's disease. Ectopic pregnancy is a complication of pregnancy in which the embryo attaches outside the uterus. Signs and symptoms classically include abdominal pain and vaginal bleeding, but fewer than 50% of affected women have both of these symptoms. Common side effects of methotrexate: nausea, feeling tired, fever, increased risk of infection, low white blood cell counts, and breakdown of the skin inside the mouth. Note: people on long-term treatment should be regularly checked for side effects. It is not safe during breastfeeding. In those with kidney problems, lower doses may be needed. Administration: methotrexate can be given by mouth or by injection, intramuscular, intravenous, subcutaneous, or intrathecal. Doses are usually taken weekly, not daily, to limit toxicity. Routine monitoring of the complete blood count, liver function tests, and creatinine are recommended. Measurements of creatinine are recommended at least every 2 months. Dosage of methotrexate. The defined daily dose is 2.5 milligrams by injection or by mouth.